Karibu katika kikao mara tena ukiwa nami Elizabeth Mutuku, lakini katika ukumbi ule wa Chandaria katika chuo kikuu cha UON kunazungumza moja kwa moja na wale ambao ni wanahabari wetu Linda Alela, Joash Onsare na Sheila Chelangat wakiwa na wataalam katika swala hili la kupambana na janga la saratani, na siku ambayo Kenya na ulimwengu kwa pamoja tunaadhimisha siku ya saratani. Lakini nilivyokuahidi nikikwenda mapumzikoni tutakuwa tukiungana moja kwa moja kutoka kaunti ya Mombasa na mwenyekiti wa kamati ya afya pale bungeni, wakati ambapo Wakenya wengi wana maswali kuhusiana na mzigo wenyewe wa kutibu saratani. Tumewasikiza wawili watatu kuhusiana na yale wamepitia, hata wengine kukosa matibabu. Kumbuka lilikuwepo hakikisho kwamba bima ya afya SHA itakuwepo pamoja na kushughulikia, lakini kwa wale ambao wameafikia swala la kutafuta matibabu kupitia bima hii kumekuwepo na maswali. Pia bunge imepiga hatua gani? Karibu sana daktari, na asante kupata nafasi kuzungumza nasi jioni ya leo.
Shukran, asante.
Nitaanza kwa kuuliza hili. Bunge limepiga hatua gani kusaidia kupambana na janga la saratani? Manake Wakenya wengi wanafariki dunia kutokana na ugonjwa huu.
Asante Elizabeth. Nafikiri nitaijibu kwa lugha ya Kiingereza kwa sababu saa ingine lugha ya Kiswahili inakuwa ngumu kidogo.
Okay.
In terms of parliamentary role,
yes,
you know Parliament has 4 roles: 1, legislation; 2, representation; 3, oversight; and 4, budgetary allocations.
Yeah.
In terms of legislation, we've done the law to create the National Cancer Institute, which is one of the sagas under the Ministry of Health, Medical Services, State Department for Medical Services. And the National Cancer Institute has a lot of, it has mandate in terms of management of, in terms of research, training, and in terms of cancer treatment. Apart from that, we've also done other amendment laws in terms of the Cancer Control Amendment Act, which the Parliament has passed. Recently, we had an amendment by the member for Imendi North on cancer control management, control and prevention. One of the roles is allocation of resources, and in terms of allocation of resources, we oversee the budgetary allocation to the National Cancer Institute. 2, we also have regional cancer centers, which have been set up through the national government. These regional cancer centers are in we have one in Garissa, we have one in Mombasa, we have one in Nakuru, and recently we have one which is coming up in Kisii. All these regional cancer institutes have, they have radiotherapy machines, and they also have capacity building in terms of management of cancer within those areas. As you realize, if somebody has to travel all the way from northern Kenya to come to Nairobi for cancer management, it takes ages, and that is informed the decision to form a regional cancer center at Garissa. In addition to that, are you getting me?
Yes, I'm getting you, Mheshimiwa.
Okay, in addition to that, we've also supported our national referral facilities, that is Moi Teaching and Referral, Kenyatta National Hospital, and KU Teaching and Referral Hospital, in terms of setting up the Department of Cancer with the radiotherapy machines, with other state-of-the-art equipment which enables them to manage cancer within those areas, and also supporting them in terms of budgetary allocation for the management of cancer.
Mheshimiwa, as far as national government is concerned, how far are we when it comes to equipping the health facilities to dealing with early stages of cancer?
You know, the early stages of cancer is not just a responsibility for healthcare workers. One of the things which you realize from the cases which are diagnosed, most of them are diagnosed when it is late, and this has something to do with culture and also misdiagnosis, because when you find that somebody is going to the hospital, like now the lady who said she went to Mbagathi and she was being treated for UTI and pelvic inflammatory disease, you realize that, and then she's gone through a lot of problems to be able to come up with the diagnosis, where you find that she's being told to do an MRI after pap smear has been done. The doctor is, after even doing an MRI, the doctor is still asking her for a CT scan. You know, this to me, this sums up to what we could say misdiagnosis. And even in a way, you would say, first, this doctor needed to even has done the staging for this cancer. And by sending her to go through all those other processes, I think it is it is a way that this is where we need to have a proper way of management of cancer within our country.
And one will want
One of the things that we've done as a parliament is to give resources to our referral facilities. And these referral facilities are capable of even doing the simple pap smears, staging those cancers, and promptly beginning even the management in terms of treatment. But you'll find that it is very sad when a client has to travel all the way from one corner of the country, maybe to come to Nairobi or visit a referral facility so that proper diagnosis can be done. I think what we need to do is to encourage our county facilities to be able to have equipment that can be able to make the correct diagnosis early enough to enable early detection, early diagnosis of cancer, and initiate proper management, or even proper referral to the various health facilities where proper management can be done.
Mheshimiwa, you've spoken of county facilities being at least enabled as far as it comes to dealing with cancer. But one is left wondering, with the allocation which is given to counties, are we really fighting with this giant disease in the country?
You know, through the division of revenue bill, you have an allocation for the counties and you have an allocation for the national government. Then the national government now will start to budget for its national resources to the various ministries. Counties will also be, the Senate will also distribute that money to the various counties. Then each county will now be able to allocate its resources to its various departments. The biggest role for county governments is health. The second biggest role for county government is in terms of road infrastructure and water. If counties are able to allocate their resources, and we are able to evaluate to see how much has gone to the various counties in terms of, because right now when you look at what goes to the counties, you are not able to clearly give a general overview of how much resources is allocated to health. in line with even the Abuja Declaration, how much the country, the national government puts, how much the counties are putting. And therefore, I think one of the things that we need to do is, now that we have the national government having put in place universal health care, and under this universal health care, you have funding to primary health care, you have funding under the primary health care to level 2, level 3, and even level 4 outpatient. So this should be able to enable counties to be able to allocate, to be able to equip their facilities with both medication, equipment, and the necessary human resource. Because counties will now be able to claim from the Social Health Authority money for provision of healthcare services at level 2, that's at the dispensary, money for provision of health services at health center level, and this money can still be plowed back, because we've passed as Parliament the Facility Improvement Fund that makes sure that every money that is generated from that facility will now be able to be plowed back to the health facility. Unlike the past, or where it is not being operationalized, where the money that is generated from the health facility does not go back to the health facility. In addition to that money which is now coming from the FIF, you have the resource envelope, which is from the Division of Revenue Bill to the county, so that the county can now be able to allocate that resources to the various. The law also allows cooperation and consultation between the national government and the county government. So national government and the county government can work together to look at what are the options in terms of deficits, in terms of maybe human resource or even equipment, where counties are not well equipped. Can we be able to look at ways of how can we equip those health facilities to meet the services that is as per that level of facility, either as a dispensary or as a health center, to make sure that we are able to put the necessary equipments so that we can have to provide robust health care.
Mheshimiwa, you've spoken of having the right equipment in the counties. And then you remind me of the MES, that is Medical Equipment Scheme, which was supposedly to help the counties in dealing with such diseases. Do you think this was a scheme which, or rather the scheme was helpful as it was anticipated?
The Managed Equipment Service was a good idea. I think the only problem was when it came to implementation, because under the Managed Equipment Service scheme, 2 health facilities per county were equipped. But unfortunately, what happened is that in some of the facilities, because it was not properly implemented, you will find that you have an equipment that has been pushed to you, and you don't have the necessary human resource to utilize that facility. I think these are lessons that we've been able to learn from that mistake. That now, under new arrangement, counties can be able to sit down, come up with an audit of the health facilities they have. What do those facilities have? What do they require? Do we have the necessary human resource to be able to deliver that service? And how do we procure those equipment to make sure that our people are able to get the necessary service and not incur costs that are detrimental or that are not beneficial to the community? So I think the Managed Equipment Service was a good idea, but implementation was a problem, and we've learned our lessons. And I think moving forward as a country, because you cannot do with those facilities when the facility is not well equipped, when the facility has no correct human resource, and when facility has no commodities, that's the health products and technology. So we must be able to make sure that we put our healthcare in the correct position so that mwananchi does not, you will ask yourself, why do people prefer at times going to a private facility when they have money? But when you look at statistics, because one of these NGOs made a presentation the other day to the health committee, 65% of Kenyans visit public health facilities. That is their first call of sender for service. And therefore, it calls upon us as a government to make sure that if 65% of our population, the first call of sender for the healthcare provision is a public health facility, why don't we make sure that this public health facility is at a level that can be able to meet the requirements to provide the diagnosis and the treatment for those 65% who will be able to call as a first call of service within our public health facilities.
All right. Do you think really we've invested much when it comes to research and sensitization of public or in terms matters cancer?
Thank you again. When you heard from the representative from KEMRI, they've had the Nairobi registry for close to 20 years. But when you look at the Nairobi registry, it is USAID funded. It's not locally funded. It's foreign-based funding. So one of the biggest challenges has been in terms of funding to our healthcare, where especially when it comes to research and research in terms of for cancer, most of it has been foreign funded. But of late, as a committee of health, we've tried to provide resources to the National Cancer Institute. We've also encouraged our institutions that are engaged in research, like KEMRI. For the last, I think, since 2015, we've been funding KEMRI for research. And what we've asked them to do is to look at research that addresses local problems. Initially, we've had KEMRI looking at issues about Mira. They've done a research on Mira. They've done a research on pyrethrum. And we have, and KEMRI, I think we've also given them some funds, and we are hoping that with those funds, they are also looking at, I think, herbal medicine. But I think it is high time that we do research that is targeting our local challenges, and the cancer being one of the biggest threats to our health care. I think we'll be able to, as a committee, to support research, especially that looks into cancer. I think the other day we had a member from Meru presenting issues about cancer being rampant within that area, and also Taita Tafeta. I think these are issues that have been raised by members from those various areas, and we would encourage our research, especially KEMRI and National Cancer Institute, to be able to look into those areas and see what is it that the committee, and I know both the health committee and the budget committee has been very supportive when it comes to cancer research and what we can be able to do. I think even when Kenyatta presented and Moi Teaching and Referral and Kenyatta University, where they bought the other day CyberKnife, which is fully funded by the GOK, and other cancer radiotherapy machines, which have been fully funded by the national government. I think we've been very supportive, and we'll keep on supporting them.
We're really looking forward into this budget to see what you will do as the chair, the health committee. But I will not let you go if I will not be asking about the SHA, because majority of Kenyans were so hopeful that SHA is going to be of great help when it comes to dealing with cancer, but it's proving otherwise, Mheshimiwa. I
think it's the opposite. You know, SHA it's not been long since it was launched in September, in October. And to say that it's not doing, you know, I tend to think we are rushing into conclusions very fast.
We are not
SHA
rushing.
has a component of chronic, critical, and emergency illness. And this is that's a fund which is supported fully by the national government through Exchequer. In the last budget, we allocated we've allocated to close to, I think, to 2 billion. Then the primary health care we put 4 billion. This is a start, and as it continues, we'll be able to look at how much subsequently we can be able to allocate. You know, this is not money that will be consumed within a day. This is money that is going to be utilized within a period of a financial year. We started the financial year, we started the fund in October. The financial year is ending in June. We will have supplementary budget in this February. Meaning between October and February, we'll be able to look at how much of that has been utilized in addressing chronic illnesses, which cancer falls among them, critical when somebody maybe has now gone to stage 4 or stage 3 and is in a situation that maybe requires intensive management. And therefore, I think we need to look at the context of that amount that has been allocated in line with the budget cycle, so that we don't make conclusions that SHA is already failing when we are trying now to make sure that everybody is being brought into SHA, people are registering, and we see how much of that is being consumed in terms of resources that the national government has allocated.
All right. Thank you so much, Mheshimiwa, because I know very well we are supposed to go to other matters, but Victor Muyakani will be continuing with the same line of questioning when it comes to cancer and the burden of cancer in the country. Lakini kwa sasa na shukuru kwamba umenipa muda wangu na muda wetu hapa ndani ya studio hizi za TV47 kuzungumzia hili na kupata pia nafasi kuzungumza nasi. Kwa sasa tunachukua mapumziko kidogo na baadaye tutakuwa tukirejea katika ukumbi ule wa Chandaria kuweza kuangazia haya na mengine mengi zaidi. Kumbuka pale pana wale ambao ni waathiriwa, kuna wale ambao ni wataalam na pia wanahabari wetu ambao ni mahiri zaidi kuhusiana na swala hili la kupambana na saratani. Na endapo pia wewe upo nyumbani na una maswali, ni kwa 22047 na sisi tutakuwa tukipitia moja kwa moja ili kuweza kuwasiliana nawe. Lakini kwa sasa ukae nasi wakati ambapo tunapumzika dakika 2 kisha tuingie kwa habari.